Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is ENT problems in the pediatric patient questions. Without delay, let's get started.
After teaching the parents of an 18-month-old who was treated for a foreign body obstruction about the 3 cardinal signs indicative of choking, the nurse determines that the teaching has been successful when the parents state that a child is choking when he or she cannot speak, turns blue, and does which of the following? 1. Vomits. 2. Gasps. 3. Gags. 4. Collapses. The correct answer is 4. The 3 cardinal signs indicating that a child is truly choking and requires immediate life-saving interventions include inability to speak, blue color, and collapse. Vomiting does not occur while a child is unable to breathe. Once the object is dislodged, however, vomiting may occur. Gasping, a sudden intake of air, indicates that the child is still able to inhale. When a child is choking, air is not being exchanged, so gagging will not occur. After teaching the parents of a toddler about commonly aspirated foods, which of the following foods, if identified by the parents as easily aspirated, would indicate the need for additional teaching? 1. Popcorn. 2. Raw vegetables. 3. Round candy. 4. Crackers. The correct answer is 4. Crackers, because they crumble and easily dissolve, are not commonly aspirated. Because children commonly eat popcorn hulls or pieces that have not popped, popcorn can be easily aspirated. Toddlers frequently do not chew their food well, making raw vegetables a commonly aspirated food. Round candy is often difficult to chew and comes in large pieces, making it easily aspirated. A toddler is scheduled to have tympanostomy tubes inserted. When approaching the toddler for the first time, which of the following should the nurse do? 1. Talk to the mother first so that the toddler can get used to the new person. 2. Hold the toddler so that the toddler becomes more comfortable. 3. Walk over and pick the toddler up right away so that the mother can relax. 4. Pick up the toddler and take the child to play area so that the mother can rest. The correct answer is 1. Toddlers should be approached slowly because they are wary of strangers and need time to get used to someone they do not know. The best approach is to ignore them initially and to focus on talking to the parents. The child will likely resist being held by a stranger, so the nurse should not pick up or hold the child until the child indicates a readiness to be approached or the mother indicates that it is okay. A nurse is teaching the parents of a preschooler about the possibility of postoperative hemorrhage after a tonsillectomy and adenoidectomy. The nurse should explain that the risk is greatest at which of the following times? 1. 1 to 3 days after surgery. 2. 4 to 6 days after surgery. 3. 7 to 10 days after surgery. 4. 11 to 14 days after surgery. The correct answer is 3. The risk of hemorrhage from a tonsillectomy is greatest when the tissue begins sloughing and the scabs fall off. This typically happens 7 to 10 days after a tonsillectomy. After a tonsillectomy and adenoidectomy, which the following findings should alert the nurse to suspect early hemorrhage in a 5-year-old child. 1. Drooling of bright red secretions. 2. Pulse rate of 95 beats per minute. 3. Vomiting of 25 milliliters of dark brown emesis. 4. Blood pressure of 95 over 56. The correct answer is 1. After a tonsillectomy and adenoidectomy, drooling bright red blood is considered an early sign of hemorrhage. Often, because of discomfort in the throat, children tend to avoid swallowing. Instead, they drool. Frequent swallowing would also be an indication of hemorrhage because the child attempts to clear the airway of blood by swallowing. Secretions may be slightly blood-tinged because of a small amount of oozing after surgery. However, bright red secretions indicate bleeding. A pulse rate of 95 beats per minute is within the normal range for a 5-year-old child, as is a blood pressure of 95 over 56. A small amount of blood that is partially digested and therefore dark brown is often present in postoperative emesis. The nurse is inspecting the child's throat. The nurse should 1. Remove the tongue blade from the child's hands after he has experienced what it feels like in his mouth. 2. Ask the child to hold the tongue blade with both hands in his lap, while the nurse uses another tongue blade. 3. Have the parent hold the child with arms restrained. 4. Guide the tongue blade while the child is holding it to depress the tongue to visualize the throat. The correct answer is 4. If the child does not stick out his tongue so the nurse can visualize the throat, it is appropriate to use a tongue blade. Having the child participate by holding the tongue blade while the nurse guides it to facilitate visualization of the throat is appropriate technique. It is not useful to remove the tongue blade or have the child hold it because the nurse will need to use the tongue blade to depress the tongue. It is preferable to engage the child's cooperation before asking the parent to restrain the child. The father of a 2-year-old phones the emergency room on a Sunday evening and informs the nurse that his son put a bead in his nose. What is the most appropriate recommendation made by the nurse? 1. Try to remove the bead at home as soon as possible. You might try using a pair of tweezers. 2. Be sure to take your child to the pediatrician in the morning so the pediatrician can remove the bead in the office. 3. You should bring your child to the emergency room tonight so the bead can be removed as soon as possible. 4. Ask your child to blow his nose several times. This should dislodge the bead. The correct answer is 3. The bead should be removed by a healthcare professional as soon as possible to prevent the risk of aspiration and tissue necrosis. Unskilled individuals should not attempt to remove an object from the nose as they may push the object further, increasing the risk for aspiration. 2-year-old children are not skilled at blowing their nose and may breathe in, further increasing the risk of aspiration. A toddler who has been treated for a foreign body aspiration begins to fuss and cry when the parents attempt to leave the hospital for an hour. The parents will be returning to take the toddler home. As the nurse tries to take the child out of the crib, the child pushes the nurse away. The nurse interprets this behavior as indicating separation anxiety, involving which of the following? 1. Protest. 2. Despair. 3. Regression. 4. Detachment. The correct answer is 1. Young children have specific reactions to separation and hospitalization. In the protest stage, the toddler physically and verbally attacks anyone who attempts to provide care. Here, the child is fussing and crying and visibly pushes the nurse away. In the despair stage, the toddler becomes withdrawn and obviously depressed. Regression is a return to a developmentally earlier phase because of stress or crisis. Denial or detachment occurs if the toddler's stay in the hospital without the parent is prolonged because the toddler settles into the hospital life and denies the parent's existence. After insertion of bilateral tympanostomy tubes in a toddler, which of the following instructions should the nurse include in the child's discharge plan for the parents? 1. Insert earplugs into the canals when the child bathes. 2. Blow the nose forcibly during a cold. 3. Administer the prescribed antibiotic while the tubes are in place. 4. Disregard any drainage from the ear after 1 week. The correct answer is 1. Placing earplugs in the ears will prevent contaminated bathwater from entering the middle ear through the tympanostomy tube and causing an infection. Blowing the nose forcibly during a cold causes organisms to ascend to the eustachian tube, possibly leading to otitis media. It is not necessary to administer antibiotics continuously to a child with a tympanostomy tube. Antibiotics are appropriate only when an ear infection is present. Drainage from the ear may be a sign of middle ear infection and should be reported to the healthcare provider. An adolescent female is prescribed amoxicillin, Amoxil, for an ear infection. The nurse should teach the adolescent about the risks associated with her concurrent use of 1. Antacids, 2. Oral contraceptives, 3. Multiple vitamins, 4. Protein shakes. The correct answer is 2. When a person is taking amoxicillin as well as an oral contraceptive, it renders the contraceptive less effective. Because pregnancy can occur in such a situation, the nurse should advise the client to use additional means of birth control during the time she is taking the antibiotic. There are no risks associated with the concurrent use of amoxicillin and antacids, vitamins, or protein shakes. After teaching the parents of a preschooler who has undergone a tonsillectomy and adenoidectomy about appropriate foods to give a child after discharge, which of the following is stated by the parents as appropriate foods, indicate successful teaching? 1. Meatloaf and uncooked carrots. 2. Pork and noodle casserole. 3. Cream of chicken soup and orange sherbet. 4. Hot dog and potato chips. The correct answer is 3. For the first few days after a tonsillectomy and adenoidectomy, liquids and soft foods are best tolerated by the child while the throat is sore. Children typically do not chew their food thoroughly, and solid foods are to be avoided because they are difficult to swallow. Although meatloaf would be considered a soft food, uncooked carrots would not be. Pork is frequently difficult to chew. Foods that have sharp edges, such as potato chips, are contraindicated because they are hard to chew and may cause more throat discomfort. The nurse has identified a problem of anxiety. For a 4-year-old preparing for a tonsillectomy, the nurse should tell the child, 1. You won't have so many sore throats after your tonsils are removed. 2. The doctor will put you to sleep so you don't feel anything. 3. Show me how to get a doll an IV. 4. When it is done, you'll get to see your mommy and get a popsicle. The correct answer is 4. When preparing a child for a procedure, the nurse should use neutral words, focus on sensory experiences, and emphasize the positive aspects at the end. Being reunited with parents and having an ice pop will be considered pleasurable events. Children this age fear bodily harm. To reduce anxiety, the nurse should use the word fixed instead of removed to describe what is being done to the tonsils. Using the terms put to sleep and IV may be threatening. Additionally, directing a play experience to focus on IV insertion may be counterproductive as the child may have little recollection of this aspect of the procedure.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.